So this is Dr. Goel, MD Medicine, DM from top medical schools in Delhi and also MD USA and DM USA. So I'm talking about overweight, and we are really overweight, then we call it obesity. So what I'm trying to say is, there were time when in the past when we look at the person and say that person is either overweight or not, but in recent years, all our doctors, and I'm sure that is true in India too, we are using a concept of what we call body mass index or BMI, and this BMI is based on our height, weight, and a formula. So let me also tell you that all the applications are BMI applications are easily available on for all the Apple and Android phones. Just download the application is all free and calculate your body mass index. So for either you put it in centimeter and kilogram, or you put it in pounds and inches, depending upon US versus India or any other country. So let me say this. We all doctors have come to the conclusion that our normal body mass index is between 18 and 25. This number, neither we are overweight, neither we are underweight. So let me say this, if our body mass index of BM is less than 18, then even if we look okay, we are still underweight. We are somewhat undernourished, and we should definitely try to eat more to bring our BMI above 18 or above 18. Issue is with lower body mass index, we do not have that much reserve in the body. So suppose there's a medical crisis, we have a fever, or we are throwing up, or we have a flu, we have to lie down in the bed for a few days, then our body won't be able to tolerate as much, and risk of illness going in the wrong direction may be high. Next line. So what I'm trying to say that, and next is like if body mass lies between 25 and 30, then that person is we overweight. So this is the term we use depending on the body mass index numbers. So 25 to 30 we call overweight, and then if person is BMI between 25 and 30, we call it obesity, and medically speaking. So this is how we differentiate. Obviously less than 18 is underweight or malnourished. Next, so all we medical professionals are agreement that if body mass index or BMI is more than 40, then we should, in a way, there is no immediate threat to your life, but we treat it as a medical emergency because we think this is too much of weight, and we will want you to help. We want to be very aggressive using every medical or surgical means to bring the BMI or body mass index before 40. There are medications, there is a bariatric surgery, there is a gastric bending, weight loss, medicine, weight loss surgery. Plus, we will do our best to motivate you, try to lose weight if you just want to go that route. So ideally, in day-to-day life, we can shoot for average body mass index of 22, but as long as we keep it above 18 and below 25, we should be happy about it. And let me be honest, it is always a challenge as we go through years of life. All of us in our, beyond 30 try to gain weight as life goes on. In those 30 to 50 years, life is very busy. We are married, we have children. So we are working hard to make both ends meet. So this is our observation that lifestyle, because of the lifestyle, we start gaining weight. Our and then our body sets at a new weight and tries to maintain it. And then in few years again, body try to reset the weight and then try to maintain it. You have to understand that we human beings for over thousands of years of evolution, uh, we needed our body needed to store energy for emergencies. Everybody was afraid of getting, killed by animal or otherwise. So, so we will, once we have a food, we try to eat and try to eat as much as we can. And then, there are sometimes we may not find food for days. We can survive, So as long as we got enough water and oxygen, we will survive for several days. And this is a evolutionary mechanism or evolutionary compensation for our body.